I'm Kuberan Pushparajah. I'm a paediatric cardiology consultant here at Evelina Children's Hospital, and I've been working here as a consultant since 2014, but started my relationship with Guy's and St Thomas's a really long time ago, as early as 2000 when I first came here to work in the A&E department at St Thomas's. And I trained in paediatrics because that's what I really liked. I loved working with children and babies and young adults. And then I got the bug to get interested in cardiology. During my training, I really enjoyed just trying to understand the heart. And I found that ultrasound, particularly clever ways of doing ultrasound like 3D ultrasound, which I did with Professor Simpson, was really fascinating. And I wanted to then try and study the heart even more. And we have an amazing MRI facility here at Guy's and St Thomas's because Professor Razavi, who's another one of my bosses at the time and now a colleague, had pioneered the UK's first MR unit looking at patients with congenital heart disease. So I got the bug. I worked with Professor Razavi and the team, and it's a really exciting way to study the heart because you can look at it in very complex ways and put together more pieces of the puzzle so that we can do the best to plan the right treatment or to just make sure everything's okay, which is also a really powerful tool for that. And also sometimes to try and work out if there is going to be a problem that might emerge in a few years' time, and therefore we can safely plan to do something about it so that our patients remain safe, healthy and happy. I have a great interest in trying to study the heart using ultrasound and MRI. In order to do that quite effectively, one of the things I've done is I work very collaboratively with the wonderful team of biomedical engineers and physicists, and these are who I call the clever people, who help at King's College London with the development and refinement of these imaging technologies that we have. And one of the best things about it is that they're in the same building. So we go to them with a clinical problem. I'll say, I need to look at this bit of the heart much more quickly because I scan little children and they can't lie still for very long. So we work together to try and make the scan a lot faster, a lot shorter, and still producing even better images so that we can make the right diagnosis. A big part of working as a paediatrician is that when you look after a child, you look after the child in the context of their whole environment. And that means their parents and their siblings, and sometimes even the wider family where that's important. When we are dealing with the most complex forms of heart disease, some of the decisions can be really hard about what the right thing is to do. Although we are the experts and can give the right guidance based on our experience and knowledge, a patient's heart condition is really a journey. And me and my colleagues, we always work with the family to make sure that everyone understands what the problem is, what we think we need to do about it. And so people don't just understand what we do, but why we're doing what we're doing. And being able to do that is really important because it empowers everyone in the team, and we're always working on the side of the team for that particular patient. So the COVID pandemic's been really quite challenging. From my perspective, both personally and as a consultant who works within a really big multidisciplinary team in a hospital, the one thing you realise that it is a pandemic, so it affects everyone. In a normal situation, the people who provide healthcare are just dealing with a medical problem, but in this situation, everyone's had their own difficulties with the pandemic, worrying about themselves, their families or their loved ones, and at the same time, they had to deal with what is a really new condition that we really didn't know much about. And what was really quite remarkable is the fact that people were able to pull together, certainly in the team that I worked with, and get over both aspects of that. You know, having the support of your colleagues and your peers to get you through the working day, and also to have the support of your colleagues and your peers to try and solve the difficulties of what COVID was presenting us with. It's a new diagnosis, and we were able to pool our resources and our expertise, treat our patients effectively, generate new knowledge, and publish all of that amazing new research, working with other centres in the United Kingdom as well as abroad, so that the wider community of patients was able to benefit from that. From a heart point of view, congenital heart disease doesn't know COVID. You know, that happens anyway, and so we continued to provide a service for all of our patients. And that remains we're committed to making sure that our patients have the best care possible. And so we've had to think of more inventive ways of involving other members of the family in discussions. There's been many a time where we've got FaceTime and WhatsApp and all of these other technologies to try and get both parents in on a consultation so that everyone feels involved and is part of the whole discussion. The question is really about how ECHO works and helps support patients and families touched by congenital heart disease. Well, really, we have to firstly think what ECHO provides. ECHO provides this amazing resource of non-healthcare individuals like ourselves to effectively pull together the experience, the wealth of experience of other families who've been touched by congenital heart disease, and importantly as well, patients who've been touched by congenital heart disease. The reason that's important is that I think as a family who is in the moment with a child who's got a new diagnosis or is very unwell with congenital heart disease, you can feel very isolated. You can feel like you're alone and nobody else gets it. But these guys do. And they provide an amazing resource that I've witnessed over the years, where my patients have come away from being in quite a dark, worrying spot and are able to really get through a very difficult time. The challenge, of course, is that in order to be able to reach out to ECHO, you need to identify with them in some way. And so one of the things that we have to do is to have a very wide range of representation within all of the bits of our organisation in the hospital as well as the charity, so that people will relate to what we're trying to achieve. Now, in order to do that, we need to have people who are able to volunteer and give up their time. And that's the challenge, because life takes over. And we have a range of communities within our patient population and families. And some people live too far away. Some people can't relate to the people who may be the face of the organisation. And then money and distance is also a challenge. So we have learned in the last 18 months, as a positive thing from COVID, to harness lots of other new ways of communicating. We communicate with each other very effectively through online resources. We communicate more effectively because we're suddenly more aware and intuitive of some of the light touch things that make such a difference. We're much more aware of just the kind of difficulties that families have, from the simple things like putting food on the table to getting your kids to school. That's been totally highlighted in the last 18 months. So from where I stand, watching the growth of ECHO, I've definitely seen a big change. In fact, it's really remarkable that all of us, even in the hospital, are trying our best to make sure that all this amazing work we're trying to do can be accessed by everyone, regardless of what your background is, regardless of what your social status is, regardless of what your financial situation is, regardless of how far away you live from the Evelina, because some of our patients are from quite a distance away.
Oh, thanks Kuberan. So nice that you spent time with us today. I'm not letting you go just yet. I have some questions from the Echo community for you. Okay. First one is from Luke, aged 20. Luke wants to exercise but spent a lot of time through his childhood being told to rest or avoid sport. He's a little bit confused about what is best and wonders, is there a scan or a test that you know of that he can take to tell him what exercise he should do?
Okay. Hello, Luke. I think it's amazing that you really are thinking about exercising, because it's really important for everyone to exercise, including myself, and I should listen to that. the main thing is to actually feel safe with the level of exercise that you're able to do. And I think it's important then for you to have a conversation and ask your cardiologist and the clinical nurse specialist who's in your clinic and talk to them about your concerns that you have about exercise and the type of exercise that you want to do.
That's really helpful. I know that Luke and others will listen to what you said there. Another question I've got from a parent is about MIs, heart attacks. So they're saying MIs are treated in PPCI, where I see imaging of lots of blood vessels done rapidly during the procedure. They've often sat there and wondered if similar live imaging would be something for the future when children are seen in clinics.
Okay, so the good thing is when you come to clinic and have your echo scan of your heart, those machines are basic ultrasound machines, but they're doing more and more powerful things. So every image we take is that of your heart beating, and it's amazing, but you may see those black and white images that you're quite used to. But we also, on most of the machines in our department now, have 3D imaging, and you can take live amazing pictures of your heart during your visit. The sort of scan that we're talking about here, looking at the blood vessels in more detail in a live way, we're not there yet, but I think, you know, I have an interest in imaging the heart, and I think that sounds like a challenge.
Thanks for that challenge. So a really challenging question next from Daisy, age 7.
Okay.
If you could be a superhero, who would you be?
Okay, Daisy, you got me there. Well, I work with MRI scans a lot of the time, and MRI scans are big magnets that are able to take amazing pictures of your heart. And I don't know if you've watched the X-Men, Daisy, but there's a man in there called Magneto, and he's got powerful hands and brain that can move things, and he's like a super magnet. And I always think it's pretty cool that Magneto can do all of that, and so sometimes I wish I could do that. Of course, Magneto, he's not always a good guy in the movie, but in his heart of hearts, he's a good man, so don't worry about that.
Well, it's our first baddie of the session, so that's great. Lastly, the Echo members would love to know, is there a past job or maybe a hobby or activity that you've been part of that might surprise the members?
I like going up mountains, but I can't do that anymore. And I just quite like digging in my garden. In the last bit of COVID, I did quite a lot of gardening, grew a lot of vegetables, and that was quite fun. But now I'm back at work again, although that's not really happening. I've gone back to succulents.
That's amazing. Thank you so much for your time today and for answering those questions, and thanks to the members for sending them in.